Welcome everyone to the New Children's Museum's True Tuesday program. My name is Tomoko Kuta. I'm with the museum, and it's really a pleasure for me to introduce this week's topic, Myths of Postpartum Life. We have four incredible specialists who will introduce themselves and share, and of course, be here to answer any questions. I want to do a little bit of housekeeping before we get going. First off, I want to let everyone know that we are recording this session so that we can share it with others afterwards. And also, if you have any questions throughout the presentation, please use the chat box. That really helps kind of keep things moving along. And if there's a super urgent question that you want answered right away, just put lots of exclamation points around it, and I'll manage that chat box. So with that, I think I'm going to turn it over to Amanda Freeman, Amy Lajiness, April Douglas, and Colleen Flaherty. So take it away. Thank you.
Amanda, you want to go ahead and introduce yourself, or should we just do each one?
Well, I think we're going to start with you, April, so go ahead.
We'll just do each.
Yeah.
So I'm Dr. April Douglas. I'm a physical therapist, and I specialize in orthopedics and pelvic floor. I own My PT to Go. So we offer concierge medical treatment. So that means I go to people's home. We can do it here in the clinic or also telehealth. And I also have a pretty active social media presence where every day I have little tips and tricks for orthopedics and for pelvic floor. So a lot of talk about poop and pee, and a lot of talk about back pain and hip pain, and really whatever ails you, really. So with pelvic floor physical therapy, I wanted to just have a slide about what it actually is, because a lot of people use that word, that I specialize in pelvic floor, and it's kind of thrown around a lot. So it is performed by a licensed physical therapist. You have to have your doctorate in physical therapy, and then also you have to have specialized training after your doctorate in order to practice pelvic floor physical therapy. The diagnoses that a pelvic floor physical therapist treats, the big ones, are incontinence or leaking, pelvic pain, diastasis recti or separation of the abs, prolapse, and that can be just heaviness in your pelvic floor after you exercise or the end of day, bedwetting, erectile dysfunction, all genders have pelvic floors, and then coccyx and tailbone pain. So those are the big ones that we see. So seek one of us out if you have that. So on to the myths. So the common myths that you hear a lot, the first one is your body will just bounce right back. Your body has had around three different body types in just 1 year. So you've had prenatal, pregnancy, postpartum. Your body has been through a lot of changes. And during this time, your body has accommodated for birth. So usually that includes the rib cage flaring, the pelvis widening, your skin stretches. These are all things that don't just bounce back. And some people have a different shape after birth. Some people don't. It really depends on genetics and you and your pregnancy and your birth. There's a lot of factors. The thing to focus on most, not your body bouncing back, are the pillars of health and healing, which is very difficult to do when you have kids, especially a newborn. Sleep is the number one. That's really hard to do with a newborn. But if you can get sleep, that's when you want to get it. Diet, and that's become kind of a nasty word. It's more about the quality of food that you're eating, the ratios of food that you're eating, not good or bad or fad diets. Exercise, and something is always better than nothing. So it doesn't have to be some crazy adventure, and it also, walk can suffice. And then stress, and there are good stress and bad stress. More of this is on managing it. How can you help yourself in those stressful situations? And are there ways to avoid it? Can you get help? All of those things. So myth number 2, Leaking is normal. This one kills me, and it's all over mom groups all the time. I hate it when this one is around. So leaking is, or incontinence is common, but it is not normal at all. There's a lot of research on this. Patients who have just been educated, so just told about, not even assessed or treated, if they've just been educated on pelvic floor contraction, they reported mild to no leaking in the first 12 months postpartum. So that's just someone who's been told about how to contract your pelvic floor. The pelvic floor physical therapy is recommended as the first-line conservative management for leaking. So all of those mom jokes and memes and all that stuff are just not true and really should seek out some treatment. For myth number 3, diastasis recti, or separation of the abs, can only be corrected with surgery. So I have here a picture of my ultrasound that I use here in the clinic. There's only a few of us in San Diego that have it. So it shows in the yellow are your abs. And so I actually go through certain exercises and techniques, and you can actually watch it. You can watch what happens to your abs and actually see the separation or lack thereof on ultrasound, which is really, really nice. Clinically, it is treated by finding personal thresholds. So wherever you are at and what works best for that individual. So if you really want to get back to pull-ups, then we assess you with pull-ups and see where you're at. And sometimes there's a certain range that is best for you. And then we slowly chip away at that. There is not a one-size-fits-all workout for this diagnosis. There are a lot of programs out there, some great, some not so great. But generally speaking, if you have
upstairs, sweetie.
diastasis recti, then I highly recommend getting an individualized program for you. Also, what you see a lot on social media is that there is unsafe and safe exercises for diastasis recti, and that's also just not true. It's very individualized. It's like saying a marathon is safe or unsafe for someone. And marathons for some people are very safe, and for others, it's not really recommended at that time. So beware what a lot of people are saying online. Seek out a professional. For myth number 4, intercourse is painful after having a baby. This is really, really common and should be talked about a lot more. Also, make sure this topic is quite taboo for some, so make sure you're telling your provider about it. Also, sometimes providers don't give the best advice every once in a while. Most do, but every once in a while, they give some bad advice, like drink a glass of wine or whatever. So if any general activity, including intercourse, is painful, please seek out a pelvic floor PT. Common reasons for that pain would be lack of lubrication. Around menopause and also postpartum, there's generally a decrease in estrogen, and estrogen helps out with natural lubrication of the tissues there, helps bring blood flow to the area, make the area nice and plump. So when you have that decrease in estrogen, voila, now that lubrication is gone. So there are ways to get it back. Medically, also in treatment, we can work on it. There can also be scarring in sensitive tissue. So with the lack of lubrication, with decreased estrogen, sometimes you're creating little micro tears in that sensitive skin because it's not as plump, not as good of blood flow. So it's almost like road rash. So another reason why it would not feel very good. And scarring. So if you've had any tearing, also C-sections, common misnomer. A lot of people say, oh, I had a C-section, so I won't have any of these symptoms, or I'm not going to have any of these problems. And they still occur. Statistically at a little lesser rate, but they still occur. Other reasons for pain are pelvic floor muscles have high tone. So that means they're gripping or they're held tight. So also imagine if you went to get a massage somewhere and you were gripping the whole time, that massage is not going to feel very good. So some of the things that we work on in PT is finding ways to stretch those muscles out, to decrease the tone, work on the lubrication, and also if there's been some sort of trauma there as well. Myth number 5, you can return to your usual workouts at 6 weeks. Everyone is unique. There's multiple factors like your fitness level during pregnancy, complications during pregnancy and birth, any new symptoms that you might have, your healing rate, your environment is a big one. You want to start all your workouts slowly and best with a professional. There are not very many, it's getting better, but there's not very many trainers that specialize in postpartum. You are lucky enough to have one here today, Colleen, who's going to help you out. But make sure that you're talking to a pro and make sure that they know what they're talking about. If there are pain or limitations with what you can do throughout your day, seek out physical therapy. If you're generally pain-free, not a lot of limitations, but maybe you just feel weak and you can't pick up your baby well, or all that stroller and all the junk that they have, then make sure you see a trainer that is specialized. And a lot of times these specialized trainers work in conjunction with pelvic floor PTs, and we kind of tag team each other and communicate on what's best for you. So off to you, Colleen.
Woo! Thank you. That's such helpful information to like lay the groundwork of where we're going. Hello, everyone. I'm Colleen Flaherty, and I am a recently new co-owner of Nature's Whisper. I'm actually in Nature's Whisper in the kitchen area. If you haven't been here in a while, we completely revamped the space and it's gorgeous, so definitely stop in. I'm a strength coach that specializes in perinatal movement. I've been in this field for over 7 years now, and I don't have kids, but I've always loved working with kids and families, and I'm just obsessed, if you will, with helping women feel strong and confident on their journey to motherhood, and obviously helping families be strong together. And so I wanted to start out with just this question. You know, we're postpartum, and if you don't have any pain and limitations, like April mentioned in her last slide, where do you begin with exercise? And this is probably the most common question I get from new moms is they either don't know where to start and they're like wondering what the heck to do, or they tried running and it was terrible. It was super painful in their hips. They peed themselves and they're just like, whoa, I thought I could run. Like I was running all through before pregnancy. I ran through my pregnancy and now I tried postpartum. Like, what's wrong with me? And just like April was saying, there's so many factors that go into movement and exercise and fitness postpartum. That's why you need such a specialist and a team to get back to not only just your fitness, but to life. You know, motherhood is demanding and we have to be prepared for it. So in the next slide, Amy, so I wanted to go through some movements. If we were all together, we would be doing these all together, but I welcome everyone to take part in these movements. And since this is recorded, you'll be able to rewatch it. And so I wanted to go through common things that you can stretch or massage as a new mom that will help get you better feelings in your body, deeper breaths, more range of motion, because if you're sitting, feeding, it can take a toll. And if you're sitting in quarantine, it can take a toll. So the first one is your chest and pec massage. So if you have a tool like a tennis ball or a yoga tune-up ball, or just your hand, we're just massaging under our clavicle. So if you find your clavicle along this line right here, just underneath it, you can just start to massage your pec muscles and down. You don't have to go too far down into breast tissue, but you want to go from your sternum all the way out around your shoulder, just giving yourself like a nice massage. This is going to loosen up tissues that get super tight. Your pec is connected to your arm, so we want to increase range of motion and flexibility of that shoulder. We can give these pecs some love, and it's also going to help us get into a good natural sitting position, a good neutral position. Because if we're sitting like this, then our pecs get super tight and we want to be able to open up. So just giving ourselves a nice massage with our hands or a tool, like I mentioned, is going to just help you be able to open up and sit better. The next movement, side body, just if you do yoga, or any type of movement, Pilates even, is just side body stretching. So just reaching one arm overhead, you can start to open up this side body. And I always say to breathe into the side that you're stretching. So can you open up and lengthen with your breath, and then also reaching with that hand just to create a lengthening experience from your fingertips to your hip. You can do this sitting, laying, standing, whatever position, just to start opening up these side bodies that can just get sticky and crunchy from activity or inactivity. So we're always making sure to do both sides. Breathing and reaching. And you can always hold for however long it feels good for. I'm gonna stand up just so you can see my legs. The next one is adductors. So without getting too nerdy in this talk, we can put our feet nice and wide and then lean to the side and stretch out our adductors. Our adductors, this whole inner line is connected with our pelvic floor. So even adductors sitting a lot can get really tight and weak, which we don't want. They're a main stabilizer, which we need to be nice and supple and also strong. But we'll get into that later. So make sure we're stretching and breathing. Again, as long as it feels comfortable, as long as you need longer than a minute, don't need to get too crazy. And then the last one, since we are sitting and we have this flex in our hip, we want to get our hip flexors open. So just a little bit of a split stance and hips moving forward can open up and elongate these front hip flexors and a whole bunch of different stuff. Fascia is getting opened up and can feel just really, really good to bring some light and some breath into this spot. And again, we would need to switch sides. Next one, Amy. All right, so now we're getting into, so now we feel really good in our body. Yes, awesome. So now what is movement for optimal functioning for parenthood? So what are you actually doing to practice for your job, your role as a parent? So these are pictures taken at both of my studios that I had. I put a sandbag in a car seat, and my pregnant clients actually practice carrying a car seat loaded up. Those things are heavy, and many people have never lifted a car seat before they've become parents. So we actually practice like how to properly pick up, how to stabilize your core to protect your spine and all that good stuff. And how are you carrying? And then also, how are you putting it into a vehicle? Because if you're not prepared for the weight moving away from you, it could do some harm, which we don't want. So then you can see, oh, real life, a baby in a carrier, and she's super strong and knows what she's doing. So this is like a side carry action. Hinging and deadlifts, you can think about if you were bending over to pick up the laundry, you are hinging from your pelvis to pick something up versus rounding your back to pick something up. We always want to focus on nice neutral spine, lengthening hamstrings, and picking something up and keeping it nice and close to us. The next one is squatting. Ina May Gaskin says women who are pregnant should be doing like 100 squats a day for a rock star birth. You do have to do 100 a day. Maybe just like 10 when you're brushing your teeth. And I can't see the last one on there.
It's lunging.
Oh, lunging. Yep. So everyone should know what lunging is. I want to keep moving forward. So Amy, you can go to the next one. I can all, yay. All right. So the biggest question about postpartum recovery is the progression. So to make this really easy, you're going from 2 feet on the ground to eventually running, jumping rope, skipping, all that fun stuff. And this is just the progression broken down from very, very stable to less stable. So you start postpartum and you start by just doing regular squats, as low as you feel comfortable going, not a fast pace, and you're breathing and making sure your mechanics are correct. If you don't know if your mechanics are correct, come see a trainer or a PT to make sure that you're doing these movements well, because you don't want to do 1,000 reps of bad mechanics and hurt yourself. That's not beneficial to you in the long run. And then you would just go single leg lunge. Now I'm going to 2 feet calf raise. Before I'm not getting any airtime, I'm not getting explosive yet. Then I'm getting single leg, like a march. Then I'm starting to do a 2 feet jump squat, then a single leg, that would be like a skip. And then eventually I'm going to a single leg explosive, which could be a run or a sprint. And these are checkpoints. You're never going past a certain checkpoint if you're having like doming and coning at your linea alba. If you're leaking, like we want you to be nice and strong and together and stable and not leaking and not having any injuries or pain before you progress to the next thing. This was just a way for you to see all of the steps along the way. It's not just like you squat and then you run. Like you need to see a professional that can help you every step along the way. And it's really important to not skip out on anything, even though I know we're all really antsy in our pantsy to get back to what we were doing. There's definitely a right way to do it to keep us safe and strong and not putting ourselves at risk for any more injury or any like long-term damage, especially pelvic floor long-term damage. And that was it for me. Thank you.
Thanks, Colleen.
Yes.
Hi, everybody. My name is Amy Lajiness. I'm a licensed clinical social worker, certified in perinatal mental health, and also an ecotherapist. So I bring people in the outdoors and connect them with the nature outdoors and their inner nature, which is my business name, Inner Nature Therapy. So I'm going to kick off the mental health portion here, and Amanda and I will be tag teaming. She'll introduce herself in just a moment. So just a few brief things to start off. Parents in the perinatal period often experience challenges. So this probably is not a surprise to anybody. And just real quick to define perinatal, some people are not familiar with that word. They've heard pregnancy, which is fairly self-explanatory, and postpartum, which is the period after giving birth. Perinatal encompasses both of those periods, so pregnancy all the way through traditionally to about a year postpartum. And many of you have probably heard about postpartum depression, and medical offices are getting better at screening for that. But the term that professionals like to use is PMADS, which stands for perinatal mood and anxiety disorders, because in my work with many moms and other parents, they often don't feel like they fit necessarily in that box of postpartum depression. I've talked with so many people who say, well, it wasn't really that bad, or I wasn't wanting to hurt myself, and so I didn't really have postpartum depression. So PMADS is a term that just encompasses all sorts of challenges that people can experience after welcoming a baby into their lives, whether through birth, adoption, or other means. So this can include postpartum depression, anxiety, post-traumatic stress disorder or PTSD, OCD, psychosis, and adjustment disorders, which is basically kind of a lot of people have adjustment challenges after welcoming a new child to their home. And then real quick, PMHC is a certification that both Amanda and I hold through Postpartum Support International. And I wanted to mention it because they're an amazing resource. They have a 24/7 helpline. The number is listed on the slide here. And their local chapter here in San Diego County is Postpartum Health Alliance. And both of these places have websites, if you just Google them. And they both have listings of professionals, so you can find the support that you need, and lots of wonderful information. So I wish I had known about them when I'd had my children, and I encourage you, even if you're feeling pretty stable, to just check out what they have to offer.
Thanks, Amy. So yeah, I'm Amanda Freeman, and I'm a psychologist. I share that certification with Amy, as she mentioned, and I am also on the board for the Postpartum Health Alliance, which, thank you for mentioning that, Amy. It's a really, truly wonderful organization with amazing providers who are all part of that and make it such a wonderful support for our San Diego community. So I'm a psychologist, as I mentioned. I have a group practice in Encinitas, and obviously my specialty and my passion is postpartum moms. And because of my interest and passion with working with moms, I've put all of that sort of information together. And I also have a coaching program called The Making of Moms, which is my new baby in life. But the myths of motherhood always come up in my discussion with new moms. What tends to happen, I've found, is that we hold up these expectations or myths as kind of a barometer for how we should be feeling. But inevitably, our real life experiences never ever add up. And it leaves new parents feeling as though they're failing, they feel guilty, they feel as if they're doing something wrong. So as April and Colleen have shared, there are multiple myths when it comes to how the body is supposed to adjust after birth. And the same is true psychologically and emotionally. And that's what we're gonna move on to next. So if we can have the next slide, please, Amy. Thank you. So our next myth is that parenthood will come naturally to you. So how many of you thought everything would just fall into place and you would know exactly what you would need to do when your baby arrived? So that was me too. Many parents often think that maternal instinct or paternal instinct will just be natural and that somehow just magically ignites the moment you deliver that precious baby. But this is the unspoken assumption that you will just automatically know what you need to do. That when you bring your baby home, you will know what to do when they cry, that you will know how to nurse or how to feed your baby, or that you will know what to do when they're not feeling well. Well, some of that's instinctual, yes, but mostly it's learned. When we bring home a new little baby, we have to get to know this little person. We have to learn alongside our babies what they need and how to respond to them. So parents, books, doctors, and friends can all help us with that learning, but it takes time, and there's definitely a learning curve. Your turn, Amy.
Right. So myth number 7, becoming a parent is the most joyful experience. I hope none of you can recognize that this picture is of me because I don't normally look like that. This is after having my first child, my husband, my mom, and a friend who was training to be a doula who were there with me. And I don't remember a whole lot other than I was not under any drugs in this picture. I did not use pain medication, which is a personal choice, and that you're welcome to do whatever you want. But I am literally just that tired. So for me, becoming a mom, it was joyful in some ways, but in other ways, it was not really that blissful. It was exhausting. It was painful in some ways, and it was just a challenge. So I think a lot of us could agree that in our culture, there's a lot of pressure, and a lot of it's implicit that this time, our pregnancy, oh, you're glowing, and you must be so excited, and this is, oh, you're going to be so amazed when you welcome this new baby. And there's a lot of well-wishers that can kind of inadvertently put a lot of pressure on us to see welcoming a new baby into our lives as just pure joy. This doesn't take into account a lot of the challenges that this time can bring. And I'm talking about pregnancy and postpartum here. So PMADs I touched on briefly. So experiencing anxiety or depression, both of those, the rates for women are around 1 in 5 for postpartum moms. So it's not uncommon for new moms to experience postpartum anxiety or depression. And there are ways to obviously to get treated for that, but it's not an experience you need to go through alone. It does not really take into account trauma or loss. So many parents coming to the experience may have experienced a loss of a child through miscarriage, or might have had some sort of trauma either in trying to conceive with infertility challenges, or trauma through pregnancy. I know I had an incredibly painful pregnancy. And so that in some ways was quite traumatic. And for some people, the experience of giving birth can be traumatic if they don't feel that they are being respected or listened to. Also, role in lifestyle changes. This is such a big one. This is maybe the issue that comes up most commonly when working. These last two would come up most commonly when working with clients. Just the challenge if partnered with somebody, the challenge of readjusting those roles in the household and what your relationship looks like with one another and with the baby, and with very sort of practical challenges that come up. Lifestyle, so suddenly you might not be working outside the home for a while. You might not have the same freedom to engage in other activities such as, you know, physical activities or traveling or going out to eat. That might look a little different. And there's a real loss there. A lot of people, they don't necessarily validate that for themselves, but there's a loss in terms of grieving some of the lifestyle changes or the role changes that come alongside with becoming a parent. And then lastly, physical challenges. So recovering from birth, that can take a while. People are often underprepared or not educated about what that can look like, and they don't feel maybe comfortable in seeking out support in that. Poor sleep, it's another really common challenge for new parents, is just adjusting to interrupted sleep and needing to really prioritize sleep for themselves. And then any sort of pain, and as April and Colleen mentioned, if you are experiencing pain, that's not something you should feel like you need to just suffer through, but definitely seek out professional support for that.
This is the myth of perfection. Mothers tend to put really, really high standards on themselves for how they think they should be feeling or what they think they should be doing. And sadly, these really high expectations are frequently but unknowingly supported by family, friends, and our wider culture. New mothers, this is the idea anyway, that new mothers are supposed to be blissfully happy and to have everything under control. And social media and pop culture tends to add to this huge feeling, and it can be very, very misleading, where for example, new moms may post snapshots or even really deliberately curated moments of their life when their real life experience may be very different. You know, really lovely example of this is a new mom who, I have a very pretty courtyard in my office area, and she took a gorgeous selfie of herself and her baby, just kind of enjoying that moment. But she was really struggling inside, but that picture did not portray how she was really feeling inside. So yeah, social media doesn't help this myth. In reality, parenting is complicated. It's sometimes overwhelming, and most often it is very exhausting. But it's hard to talk about, and it's not easy admitting that you don't have it all together or that help is needed. And it's hard because parents feel shame in sharing their struggles, and this gets in the way of getting the help and support that you might need. Next slide, there we go.
Yeah. Okay, so myth number 9, you'll bond immediately with your baby. So pregnancy and postpartum, again, we can talk about sort of trauma or loss. If people have had a previous loss or have had infertility challenges, this can particularly be difficult because you might really want to bond with that baby, and there's something holding you back, some fear of loss in the future, things like that. So there's plenty of sources of potential just challenge in bonding with a baby that could have to do with that, or could be completely different. So pregnancy and postpartum hormones do facilitate bonding. So prolactin, which is responsible for breastfeeding, and oxytocin, which is also known as the cuddle hormone, can facilitate bonding. But there are also reasons why this may not happen right away. I remember with my first child, I didn't really feel, I wasn't like, ugh, get it away from me, but I didn't feel a real strong connection with him for a while because I was so nervous during my pregnancy that maybe something would go wrong. I was on Dr. Google a lot. That was probably a mistake. So personal attachment styles, depending on your relationship with your family and your childhood experiences, that can definitely come into play. And that's something that I would encourage you to explore with a therapist who's trained in attachment. Again, pregnancy or birth trauma, if you have a challenging pregnancy or pain, there might be a lot of complicated emotions, especially if you felt a little ambivalent about the pregnancy. That can also contribute to this. PMADs, if you're feeling really anxious, for some people who are experiencing postpartum anxiety, the baby can be a source of anxiety. And so if that's the case, it can be very difficult to feel bonded and close with the baby when being close with the baby triggers anxiety for you. This was true for me a little bit with my second baby. It just was very overstimulating for me. So again, speaking out about it and finding that you're not alone in it is such an important part of really supporting yourself and obtaining support for any of these challenges and myths that we're talking about. Speaking the truth about what, busting these myths, right? Finding out what is actually going on and what's the real experience for many of us. And then lastly, you're still trying to get to know an entirely new person. So think about if you're dating somebody, right? I know it's a little different than growing somebody in your body, or adopting somebody and waiting for them. But if you're dating someone, it takes some time to get to know them, right? You're not, you don't just jump in and feel so in love with them. You have to get to know them, and what are their preferences, and what are their habits, and what do they like, and what do they not like, and what makes them laugh and smile. It's the same with our baby, right? As we get to know them, it's just going to increase that sense of bond and that sense of competence and confidence in ourselves as parents, that we know this person and we love them for, their little dimple, or for the way that they love looking at the trees outside, or whatever it is. So as you get to know your baby, love can follow on that. All right.
Yeah, so this is the idea, this myth at least, is the idea that the baby will bring you and your partner closer, or at the very least that things will stay the same. And then the baby comes, and sleeplessness most likely hit you both pretty hard. And the demands for caring for this little one are more than you might have ever imagined. The fatigue is real. And all of the changes that your body has gone through is matched by all of the psychological changes you are going through. And similarly, your relationship is changing right alongside all of this. Sometimes that change is smooth. Most times it's quite bumpy as you're both figuring out your new roles, you're figuring out how to do this, you're figuring out how to relate to one another again. And the research even shows that 67% of couples struggle in that first postpartum year. So it takes intention and time to reconnect with one another again. Okay, next slide. There we go.
All right. Myth number 11, your partner will know your needs. I think this is a myth regardless of whether or not you have a child. And this is another one that comes up quite often with not even moms who are in the first year. I primarily work with moms, but I'm certain other parents would feel the same way. But also beyond that first year of postpartum, this continues to, as the baby's needs change and sometimes escalate as they're toddlers, this theme continues to come up in couples often, that the partner is not responding to what I need. And again, communication is so key here. So ideally, you'll be able to feel safe and supported in order to share those needs with your partner. The needs are often going to be higher than normal, or at least different than normal. And one of the things that I find is that often the communication or the conflict tends to be about surfacey things like, oh, you didn't do the dishes, or you're not home when you said you'd be home, something like that. And then underneath that are really some deeper concerns about, do you still prioritize me? Do you see how hard I'm working to take care of this baby? Do you see how I'm suffering, or do you see how I'm lonely? And so often underneath these kind of squabbles or domestic sort of disagreements, there's often these much deeper sense of fear or doubt or concern over how your relationship has changed because of the baby. So this is something, again, that a therapist can help you identify what's really going on and help you to communicate those things to your partner. But keep in mind, physically, mentally, emotionally, relationally, all of these things have undergone such a huge adjustment throughout pregnancy, certainly, and then again in the postpartum period. And so often people they can be a little surprised about how needy they are, and perhaps needy is not the right word, but that's how they see themselves. And there can be some shame around that. So recognizing that this is a really challenging time, and that's one of the myths that I think all of us are collectively busting, is that it's just, something that's normal. And yes, parenthood is normal, but I think there's a bit of a taboo about speaking about some of the challenges that I hope that you felt that we've busted through that a little bit today, that there are challenges. And though there are challenges, there are ways to receive support, to seek out support, to support yourself. And there are ways to move through.
So this is our last myth that we're busting today. And this is a really hard one for new moms. Nothing really prepares you for just how much time and attention a little baby needs. They're just little, right? But they need so much. But when we factor in all of the changes that your body has gone through, and the fatigue, and all of those beautiful plans that you had before the baby arrived for refinishing the bathroom, or learning how to knit, or maybe these were mine, or getting your body back, it just isn't realistic. And this wouldn't be so bad really if new moms were able to be kind to themselves in this, rather than beating themselves up for not accomplishing their pre-baby goals. The added pressure also sometimes comes in from needing to return to work, because this reduces your time with your baby even more. So I guess the messaging here is to really just take that time to take care of your recovering body. Take that time to nurture yourself, to bond with your baby, and to tend to your partnership, because truly that is enough. So we've come to the end of this particular talk, and I think we would all love to hear and respond to any questions that you might have. So please feel free to ask them now, or if you prefer to reach out to us independently, we're all very open and are available to be a resource for all of you, and we'd be more than happy to speak with you. I think on behalf of the four of us, myself, Amy, April, and Colleen, we'd like to thank you for your time today, and would also like to give the New Children's Museum a huge, huge shout out for making this time and the space possible for us to connect with all of you.
This is really great. Thank you so much.
Yeah.
So let's see if, I haven't seen any questions come through the chat box, but I'd love to know if there are any questions now that we would like to ask Amanda, Amy, April, or Colleen. People a moment to kind of think through.
Yeah.
So one thing that I want to ask is, my son is now 12, and I feel that I've made it through the postpartum period. Is that true? Or am I so crazy? So I was someone who was undiagnosed with postpartum anxiety. And I think my son was already like 5 or 6 when I realized, oh, that was why I was so crazy. And I wish I'd known better. Mm-hmm. I wish I had had, the opportunity to reach out and get some support, because I was kind of a wreck.
Yeah.
Frankly. Yeah.
Oh.
So does postpartum, does it end at a certain moment, as moms?
Well, I think that you go through waves, maybe. And Amy, jump
Mm-hmm.
in if you wish to, but I think we go through waves, and it's maybe in your case, Tomoko, it sounds like it was undiagnosed, untreated, so you probably struggled through it much longer than typically you would have had to. But I think it does end at some point. There may be vestiges of it that still kind of creep back up, and I think this is true for anxiety in general too, where sometimes we're faced with new situations and that old anxiety comes knocking on the door again, and we're having to address it again. But that's kind of how I see it. What do you think, Amy?
Yeah, I agree. I think the official definition of postpartum is 1 year, but yeah. I take issue with that, because I've worked with moms who who have felt like, oh, I don't qualify. My baby's 16 months old or 18 months old, so I should have kind of figured it out by now, or this isn't really postpartum anxiety. And I think that fails to capture how the challenges of parenthood change. So yes, we do have very unique challenges as we welcome a new baby into our family, and but there are also massive changes, you know, throughout childhood, but I would say especially from 0 to 3, where it can be a real shock for parents to go from, oh, here's my baby, and they're, you know, they're needy, but they sleep a little more, and then toddlerhood hits. And for some parents, especially people who are, I consider myself a highly sensitive person. If other people are unfamiliar with that, I suggest you look it up. It's has to do sort of overstimulation. And so for me, toddlerhood was a real challenge, because suddenly they're running around everywhere and talking a whole bunch. And so it can bring up some really different types of challenges that are still related to adjusting to becoming a parent. And the second thing I'd like to say on that is that that if you are experiencing challenges postpartum, some sort of a PMAD or even just difficulty, and it is left untreated, which it so often is, because I hear it time and again from moms that say, oh, well, other people have it worse. They're like, it wasn't really, they didn't feel they met some sort of a threshold, whatever the threshold was in their mind, but it's not bad enough, or I should just suck it up, or, you know, oh, I get a longer maternity leave, so I should be okay, whatever it is. We're great at making excuses of why we should be able to manage it on our own. And so I've worked with moms who, you know, have older children, and like you, Tomoko, and still have not really processed through what were oftentimes difficult or even traumatic experiences from pregnancy or postpartum. And so I'd say it's never too late to seek out support. You know, if you have a child who's even grown and yet this period was very challenging for you, it can be really helpful. It's a massive time of transition, so it can be really helpful to process through that.
Yeah. Thank you.
I will say, for the physical side versus mental side, they do say what Amy said, that postpartum is the first year. So a lot of the articles and journals that you read, technical is 1 year. But in my world, in physical therapy, pelvic floor, they say postpartum is forever. You always had a baby, your body still went through that. And so it doesn't really matter. And so the good news is that there's always people like us to help you at any phase, whatever, how far out you are or how fresh it is. And then there's also some people who have no symptoms whatsoever, and they come in for a little checkup. So there's some people that come in and get treated, which is my favorite. They come in after birth and say, I don't really have any symptoms, but I want you to check out my pelvic floor, my body, like make sure that I'm on track. And I know me personally, I've sought out mental health, a mental health therapist when, you know, I went through a crazy experience and I just wasn't sure if I was on the right track. So I highly recommend, even if you just aren't sure, to like check in and have a pro help you out.
Yeah. And on my side of it, I have women who come in and, just like you're saying, April, like they don't have any symptoms, but then they come in and, you know, as soon as I put them through an assessment, we start like being the detective, and we find all these clues that they've been, you know, they didn't even know existed because it's a blind spot, or they just ignore the pain or whatever. And I have women that have grandchildren, and we discover things, and they'll tell me stories that relate to when they were pregnant or postpartum. So I agree with April, your body is always going to remember, and we see that for, you know, the lifetime of mothers.
Yeah, great. So we started the conversation between the museum and April in particular, but with the whole group, you know, before this whole COVID-19 closure. And you were about to, or had been meeting regularly with clients in different parts. Was it different parts of San Diego? And I'm hoping that we can revisit that scenario, you know, with the New Children's Museum as a possible location. And I'd love to, you know, number one, just share that with those who have joined us today on Zoom. I think you saw that these 4 women present just a whole range of expertise and life experiences. And thank you, for sharing your very personal experiences as well. But I'd love to know if you'd like to stay in touch. Once we do reopen, we have you come down to the museum and be a part of these sessions. So if you're interested, just, send me an email address in the chat box and I'll hang on to it. You won't be, sent any other information than this group of information. But I think it's something that's important. When I had my child, I was ecstatic. I was a very much older mom, gone through incredible infertility treatments, extremely expensive. I think I could have bought maybe like a Maserati with the amount I spent, but I finally had a child and I was thrilled, but it was such an isolating experience. And so I'm a huge proponent of bringing people together, now, after COVID-19. So let me know, and we hope to meet you in person. Just checking in to see if there's any other questions from the group.
Hi everyone, I'm Lonnie. I work at the New Children's Museum with Tomoko and Amy, and thank you so much for this amazing talk, which I also wish I had many years ago. I have 2 daughters. One is almost 16 and the younger one is 4. So I have a pretty wide range between the 2 of them. And I kind of have like a comment / story / like idea, because all of this reminds me about how with my second pregnancy, I struggled a lot with postpartum anxiety. And there's this place in our house where there's a corner where the fireplace is that juts out. It's like a tile corner that I swear I always saw death. Like it was like this nightmare scenario in my head that I could not get out. And anytime the baby was around or near, I was just like paranoid about a life or death situation all the time. And it makes me think about new moms in our very industrial building. If anyone has ever been there, it's a beautiful space with amazing installations, but it's very hard and it's very cold and it's like a warehouse. It's very contemporary space. And so I think about how, a lot of our staff might not necessarily understand the gravity of what happens in new parents' minds and bodies, and how conversations like this are really important, because in order for us to really achieve what we're trying to do for families, new families with a new baby, we really need to understand what is happening inside. And so I just wanted to share that, perhaps we all can go back to the museum one day, but that there is a real opportunity to do some sort of training for us to get us in that, I've learned a lot of design thinking techniques, but I think that this is an important conversation. If we're truly going to be a place for children, we need to know what it's like for new parents, because it's scary, it's terrifying, and you don't know how to communicate anything. And I am grateful for all of the information you've shared, and just remember how traumatizing it is, but that there's so much opportunity for us to be a place and open up, a dialogue.
Thank you for sharing that, Lonnie. That's very personal.
Yeah, thank you.
Story. I appreciate that, and I think that's those kinds of images or thoughts are very common in new moms. Very common. Absolutely recognize that experience that you had, but I think it's part of what Amy was talking about earlier and what I was talking about too, it being part of the PMEDS sort of experience, where those sort of intrusive thoughts can be really upsetting, but also to recognize that they're just thoughts, and nothing, you are safe, the baby's safe. And I think that's true for the Children's Museum too, that it is a safe place and it is a safe environment, and that there are supportive staff there. Clearly, you're all involved in this. So those new moms and new parents will be very safe, and to feel reassured there, I think the warmth and sort of vulnerability that you're sharing right now will come through as they start to come back into the museum, and as we all start to re-enter society.
Thank you.
Yeah.
Yeah, just to second what Amanda said, I think it's like 90% of new moms have what we call intrusive thoughts about, it's often about accidentally harming, that's the number one, is accidentally harming the baby, like dropping the baby on the stairs or tripping when you have them in the carrier. And so that in itself is not, that's not a PMAD, that's not something that you would automatically need to seek out treatment for unless it's something that is upsetting for you or is really disturbing your daily routines or causing you distress in some way. But I talk a lot with new parents about how I don't want to say disrupted, but how changed your nervous system can be, because there's this new, almost visceral awareness of, I must protect my baby. And that can come along with some hypervigilance and some, being a parent, I think, is one long exercise in hypervigilance, right? And so in some ways, right, we're just trying to care for our child, and are they safe, and do they have what they need? And so I do believe it really changes our nervous system a lot. And we have to come at ourselves with a lot of self-compassion. And I know Colleen, we talk about the nervous system, Colleen and I do, and she's always like, vigorous physical activity. So ways to comfort your nervous system, but also to just work through those cycles of stress and nervous system arousal is so important. I think that's a whole other topic of conversation we could address at some point.
Great. Well, I'm just checking to see if anybody else would like to comment or ask a question. And if not, thank you so much for sharing your contact information. So I think everyone can see that. And if for whatever reason you missed it, you could always reach out to us at the museum and we will connect you to these incredible 4 women. So maybe this is where we wrap things up. And I just say thank you much, Amanda, Amy, Abel, and Colleen, for sharing your expertise. Thank you everyone for joining us on True Tuesday today. Our next session is going to be in July. Please stay tuned for our content. And again, as I mentioned, we want to bring groups of women together, groups of new moms together. So please continue to stay in touch with the Nutrition Museum. I'm hoping that these 4 women will, be the ones will come to the museum and welcome you all back. So with that, just want to thank you all. Have a great rest of your day and week. And Saturday is July 4th. And so I hope you have a happy and safe holiday with your families.